Good evening to all of you. Today we are going to do MCQ challenge of obstetrics and gynecology. This is a very important subject as far as NEET PG is concerned. About 25 to 30 questions from obstetrics and gynecology appear in the NEET PG exam and about 20 questions in the INACT exam. And all the questions are quite conceptual and some of them are very easy also. Remember the topics are repeated. Sometimes the questions are also repeated. So if you practice the MCQs again and again, it is you are 100% sure that you will mark the correct answer and you don't have to think twice before marking the answer if you practice well. So let's begin with the first question. Zygote with zona pellucida. Zygote with zona pellucida reaches uterine cavity by A 2 days, B 4 days, C 5 days, D 6 days. What do you think is the correct answer? Please type in the chat box. It should be highly interactive. If you type the correct answer in the chat box. So, what do you think is the correct answer? It is 4 days. The zygote with zona pellucida reaches the uterine cavity by 2 days. 4 days. So, correct answer here is B. The role of human placental lactogen is A. Stimulate milk production. B. Fetal breast development. C. Growth of fetus. D. Endocrine. It is growth of fetus. Most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tube. B. Isthmus. C. Ampulla. D. Infundibulum. This maximum propensity to rupture is the isthmic ectopic pregnancy, and minimum propensity to rupture is ectopic ampullary. So the correct answer here is C. Ampulla. Please click the link in the description box to join the ultimate 2-day NEET PG Breakthrough Blueprint Class Masterclass. It covers all the 19 subjects in a holistic manner. During which gestational age is peak serum HCG level attained? A. 7 to 9 weeks, B. 11 to 13 weeks, C. 20 weeks, and D. 25 weeks. This HCG, that is human chorionic gonadotropin, rises progressively from conception. Level doubles on average every 30.9 hours until it reaches value reaches 6,500 milli international unit per ml or 6,500 international unit per liter at approximately the 8th week after the LMP, that is last menstrual period. After that, the rate of rise becomes individualized, peaking between 60th and 70th day LMP. HCG decreases slightly between 12th and 16 weeks post LMP and then remains constant until birth. So the correct answer here is A, 7 to 9 weeks. What would be type of presentation when engaging diameter is mento-vertical? A, face, B, brow, C, vertex, D, breech. What happens in brow presentation? The engaging diameter is mento-vertical, that is 14 centimeter. What is brow? Brow is the rarest variety of cephalic presentation where the presenting part is brow and the attitude of head is short of the degree of extension necessary to produce face presentation. In face presentation, the presenting part is face. The attitude of fetus shows complete flexion of limbs with extension of spine. The commonest position is left mento-anterior. The engaging diameter of head is submento-pragmatic 9.5 cm and fully extended head or submento-vertical 11.5 cm is partially extended head. So the correct answer here is B, brow. Most common cause of secondary PPH is A. Uterine inertia, B. Retained placenta, C. Episiotomy, D. Cervical tear. The correct answer here is B. Retained placenta. Incidence of scar rupture in subsequent pregnancy in case of LSCS or lower segment cesarean section is A 2%, B 4%, C 5%, D 8%. The risk of lower segment scar rupture is low, and even if it does occur, maternal death is much less, and the perinatal mortality is about 1 in 8. 2%. Subpubic angle is A less than 65, B 75, 65 to 75, C 85 degree, D 110 to 120. It is 85 degree. Rule of assay is used to determine A the age of fetus, B the height of an adult, C the race of person, D identification. So it is the age of fetus. Indication of acyclovir in pregnancy is A. Disseminated herpes, B. Chickenpox in first trimester, C. Prophylaxis in recurrent herpes, D. All of the above. It is D. All of them. Human placenta is A. Discoid, B. Hemochoroidal, C. Deciduate, D. All of the above. It is D. All of the above. Human placenta is discoid because of its shape. Hemochorial because of direct contact of chorion with maternal blood, and deciduate because maternal tissue is shed at percussion. Hot flushes are experienced as a result of A. Increased noradrenaline, B. Decreased estrogen, C. Increased noradrenaline, decreased estrogen, increased noradrenaline, estrogen. It is increased noradrenaline and decreased estrogen. Cephalic index is BPD upon OFD, BPD upon SC, OFD upon BPD, SC upon FL. It is BPD upon OFD. In MRKH syndrome, which among the following is absent? A. Vagina, B. Breast development, C. Pubic hair development, D. Testis. It is testis is absent. Polyspermy is inhibited by which ion? A. Calcium, B. Na, C. K, D. Cl. The calcium wave amplifies the local signal at the site of spermocyte interaction and distributes it throughout the oocyte cytoplasm. The increase in calcium concentration is the signal that causes the oocyte to resume cell division, initiating the completion of meiosis II and setting up the development program that leads to embryogenesis. Maximum amniotic fluid is at A 32 weeks, B 34 weeks, C 36 weeks, D 40 weeks. It is 36 weeks. Fertilization usually occurs in which part of fallopian tube? A. Fimbrial end, B. Ampulla, C. Interstitium, D. Isthmus. It occurs in the ampulla of the fallopian tube. Physiologic change in leukocyte numbers in pregnancy is A. Neutrophilic leukocytosis, B. Lymphocytic leukocytosis, C. Neutropenia, D. Basophilic leukocytosis. It is neutrophilic leukocytosis. Weight of uterus at term is A. 400 to 500 gram, B. 600 to 700 gram, C. 800 to 900 gram, D. 900 to 1000 gram. 900 to 1000 gram. Urinary retention earliest in pregnancy is seen at A 10 weeks, B 18 weeks, C 22 weeks, D 34 weeks. It is rare. It is classically described in some women with retroverted uterus between 8 to 12 weeks of pregnancy. So the correct answer here is 10 weeks. Down syndrome is earliest diagnosed at A 8 to 10 weeks, 10 to 12 weeks, 12 to 14 weeks. It is 10 to 12 weeks. When is the folic acid started in pregnancy? 4 weeks prior to conception, B 8 weeks prior to conception, C 4 weeks after conception, D 8 weeks after it is prior to conception, and it is 4 weeks prior to conception. Term placenta weight to baby ratio is A 1:3, B 1:4, C 1:5, D 1:6. The correct answer is D. Persistent occipital posterior position is most common in which pelvis? A. Android, B. Gynecoid, C. Anthropoid, mixed. It is android. Pregnant uterus will compress uterus at A. Pelvic brim, B. Uterovesical junction, C. Trigone, D. Uterovesical junction. It is pelvic brim.